Has this morning, in fact right now, is announcing a nationwide plan to tackle hospital waiting lists. A special task force will be launched in response to the pressure the COVID pandemic has put on hospitals. The number of people waiting longer than, get this, 4 months for their first specialist appointment have doubled since the pandemic. The number of people waiting longer than 4 months for treatment has more than trebled. So, for reaction to today's announcement, New Zealand Nurses Organisation President Anne Daniels is with me. Good morning, Anne. Thanks for being with us.
Good morning.
So, first of all, can I just, because you've been a nurse for, is it 43 years? Have I got that right?
Yeah, I hate to say that, but it's true.
Have you ever seen it this bad?
Never. No, it is absolutely abysmal. And as a nurse, because I still work casually in a hospital, I see the patients coming in much, much sicker with much more complexities, and it's taking longer and longer for us to actually help them.
Given that there's such a long backlog, the line is so long, what does it mean for you on the front line? Like, do you have less time with the patient?
That is absolutely correct. We're always prioritising who needs care first. We have a triage system, so that means that if you're a triage 1, you need to be seen immediately. If you're a triage 2, you need to be seen in 10 minutes. People who need to be seen immediately are seen then, but everybody else gets to wait, even if they are very, very ill. And for the nurses and the doctors and the health workforce, making those decisions really, really hurts. And it's one of the reasons why I think a lot of nurses and other health professionals are actually leaving, because they cannot face the trauma of seeing our patients suffer.
So you're actually saying to people who you know need help soon, not immediately like they're dying on the doorstep, but that they need help, very, very quickly, and you're not able to provide that, that's killing the spirits of nurses across the country.
It absolutely is. Having to apologise throughout your entire shift is just the norm. I'm sorry, I will get back to you. Sorry, I didn't get back to you. These are the kinds of things that we actually have to say. And knowing that there is somebody lying in a corridor space where they shouldn't be in the first place, and not being seen, puts that patient at risk. And it means that we don't know what we don't know. And the fact is that we need more people on the floor. We need more investment, and we actually do need the government to start talking to the nurses, particularly the NZNO. We represent 55,000 members. We're the biggest nursing health workforce in the country. And yet we still haven't actually been at that table where these decisions are being made.
Okay. So
I'm going to be very interested to hear what the minister's got to say.
Well, I'll tell you. He's announced a task force to get the wait list down and, try and speed things up, because he says if we were to try the same approach we've always used to this, get this, he says it could take between 3 to 5 years to clear the planned care backlog. 3 to 5 years. He's hoping we can do it sooner. So he's announced a task force to try and speed the backlog up. And he's announced members of the task force, including Wellington GP Dr Jeff Lowe, who chairs the General Practice New Zealand, Auckland DHB Funding and Development Manager Joe Brown, it includes Bay of Plenty DHB Clinical Director Linda Chalmers. I can't see that you're on here, Anne.
There's not one nurse. Whenever decisions are being made about the health system, the nurses, particularly the NZNO, are not invited to the table. And I have to actually ask the minister, why is that? Why are we not there when we represent the biggest workforce? We are at the bedsides, we're in the communities, we're in the GP clinics, we're in the outpatients units. Aged care facilities are closing because there are no nurses. The work doesn't get done if we are not there. So why are we not at the table?
Do you know why? Do you have an idea? Do you have a suspicion, Anne? Seems odd.
Hello?
Hello. Do you know why they're not inviting you?
No, I have no idea, but I would love to have that discussion.
Yeah. Well, thank you for the work that you do. I'm sorry that nurses are feeling this way. As you say, nurses are there obviously because it's their job, but more importantly because they find meaning in the work that they do, and having to say no, having to say, I'm sorry, we can't do it, we can't do it, it must be absolutely heartbreaking. So thank you. We appreciate you.
And Melissa here, I can see this seems really emotional for you, actually, that you haven't been included.
We actually do have a lot of the answers. We know what the problems are intimately. So therefore, why wouldn't we be at the table? And I would love to understand why we're not being invited. And this is not the first time. Nurses were virtually invisible in the development and lead up to the Health Authority and Maori Health Authority. So it's a continuation of something that has actually been there for years.
Yeah.
We've been speaking about nursing shortages since 2006, yet we've never really been invited to the table to talk about that, and we've got the solutions there.
Yeah.
If the nurses are not there, the work won't get done.
New Zealand Nurses Organisation President Anne Daniels. Thanks
Good on
very
you,
much,
Anne. Yeah, well said.
Thank you very much.